Hello everyone, I'm Dr. Abhinav. So I've recently cleared my DNB Anaesthesia exams. I thought I'll share my knowledge in about these exams with you. So before we start, you can join our Telegram group. The link is in description. And this is for mainly for people who are giving their DNB Anaesthesia exam. Also for MD students who like to give DNB Anaesthesia exam, and for your DNB FAT exam also this will be useful. And so what will I be discussing today? So majorly we'll be seeing the sources where you can read for this exam, and if you're in your first year or second year or even in your final year, you will know how to take notes. And we'll also discuss on different types of questions commonly asked in the exam, such as systemic changes, uh, and regarding the anesthesia goals, case for long case questions, and procedures, drugs, blocks, how to write these kind of questions, and general on types of question asked and past year questions, the most important questions which are repeated every year that I'll be telling, and some details on exam day preparation and all those stuff. So the main sources where you can study is from this Cambridge Basic Physiology for Anesthetists. This book is very good, and your major chunk of the preparation will be coming from Kaushik Jyotinath Anesthesia Review book, and you will also need to read on Objective Anesthesia Review book. Though this Objective Anesthesia book is more important for practical exam, many questions from theory exam also are from this book. So apart from that, you will also have to read the yearbook, which will have the recent advances, and in your fourth paper this recent advances are asked, and the last 5 year DNB previous year questions also you will need to learn. That questions are available in the Telegram group, so I'll share the file there. And apart from this additional sources, you can use this eSafe Anesthesia website, and also you can use Chat GPT whenever your concepts are not clear, you have difficulty in understanding certain things, then you can use Chat GPT. It clears out the concepts in a very simplified manner. And coming to notes taking, so if you're in your first year or in your second year, it is the best time for you to start taking notes. So when you take notes, imagine you're preparing it for the final exam and not just for that period. So whatever you prepare, make sure you will be using it again for the final exam preparations as well. So what I would suggest you is make a separate notes for each subject. So I've given the subjects list here. So make sure you make a separate note for respiratory system, one for CVS, and so on, as I have given here. So apart from that, you will need to start your notes taking with physiology, and then you go to anesthesia. Don't directly jump into anesthesia, because some concepts will be difficult for you to understand if your physiology is not clear yet. So make sure you read that Cambridge book, and in that you will be learning all the physiology concepts, and then if you go into the anesthesia part, it will be easy for you to understand, and it will be easy for you in the practical exam also, because your concepts will be cleared. And how will you prepare? So do not directly start with Kaushik Jyotinath book. So make sure you first read physiology and then go into Kaushik Jyotinath book. So the order of preparation I would say is first read respiratory system and cardiac system physiology, and then go into all small subjects physiology plus anesthesia, and then read respiratory and cardiac anesthesia part, because they are very big. And then you can read on drugs, instruments, machine monitors, and make sure you read on biostatistics. It is very important. There is definitely one or two questions coming from biostatistics, and one question will also be coming from consent, informed consent. So this is how the examination happens. So you'll be having 4 papers. Each question paper will be 100 marks, and you will be given 3 hours to complete the papers. So 4 papers, each paper per day, and paper 1 will be mostly basic science in anesthesia and biostatistics plus consent. So these things will be in paper 1, and paper 2 will be more it will be more of systemic diseases with regards to different systems, and paper 3 will be anesthesia subspecialties such as pediatric, onco, neuro anesthesia and cardiac anesthesia, and paper 4 will be in ICU, pain medicines and recent advances. So for recent advances, I have told you that yearbook you can learn from there, and it is not a hard and fast rule that these topics come in these paper only. There is a lot of overlap between them, so you will have to be prepared for everything when you go for the exams. You can even have biostatistics questions in paper 3. So it's most of the time it is as per how I've given here, but there can be occasional changes where questions can be mixed in other papers as well. So how is the mark allotment done? So there are commonly asked case questions which will be asked for 10 marks. So for example, you might be asked about anesthetic management of a CKD patient for 10 marks. So if they have asked for 10 marks, so whatever you write, you must have seen whatever you write, most of the students get 7 marks or hardly a maximum 7.5. This is because the mark allotment is such. So most of them do not write the introduction and the conclusion part, which carries 1 mark each. And there are additional marks also if you write recent guidelines or recent articles on that topic. So these things carry extra mark. So most of them do not write these things. So if you are going to write these, then you will be having an edge over the others, and you will be able to score more marks than what they give regularly. So overall, when you have to pass, it becomes easy for you. And so they can also ask for as 5 mark questions, and in the same manner you will have to write, but each subtopics will be given half the mark as mentioned for this 10 mark question. And what kind of questions are asked now? So commonly, previously they used to ask this case kind of questions which carried full 10 marks, but nowadays they have started asking 5 plus 5 different parts in each topic, or 2 completely different topics, or even 2 mark questions, 1 mark questions also. So you will need to be ready to answer all these questions. So you should not waste your time in deciding how will I answer these type of questions during the exam. So during the exam you should be prepared and ready. So when you see the question, you should start answering. So for case questions full 10 marks, you will write it as introduction, preoperative parts, intraoperative parts and postoperative parts, and then conclusion. So that I have discussed in the upcoming slides, you can see. And anesthesia considerations and management, so it will be like 5 plus 5 marks. So anesthesia considerations, you will have to write the important considerations for that case that they have asked. You need not write everything. You will have to write the important consideration. For example, difficult IV line, difficult airway. So those kind of things you will have to write. And you can elaborate 2-3 points below it. So for example, difficult airway, then you can write 2-3 points below it. So as such consideration, you can write some 8 to 10 points and slightly elaborate on it. And management part, you will have to write how will you manage this patient pre-op, intra-op and post-op. So again, it is for 5 marks. So you need to know how much to write. If you write everything, then you will not have time to complete the question. So writing is also writing is an art. So you will need to practice it. So with practice, you will be able to figure it out. How will you write? And then there are also questions asked such as pre-op evaluation and optimization. So this is just the pre-operative part which they've asked for 10 marks. So for evaluation, you will need to write separately on what will you ask for history, physical exam, investigations, And in optimization, what will be your pre-op orders? How will you manage the systemic diseases? So what kind of protocols will you use? So those things you will have to write for 10 marks. So in this you will you're not asked to write about intra-op and post-op, so it is not required to write. There can also be two different topics asked, such as CKD and cardioplegia, like this. So you'll need to write for 5 marks each question. And there are also this new type of questions where they are asking like 2 plus 2 plus 2 plus 4. So these kind of questions you'll need to know that you are going to write a lot. So you need to answer for the amount of marks that they have asked. So if it is 2 marks, make sure you write as a 2-mark question only, need not elaborate so much on it. So be specific to what they have asked. So generally when you write, you need to show that you are a safe anesthetist. So you should not be very adventurous. So you'll have to show them that safety is your topmost priority. And then be systematic in writing, so that when you practice writing this FAT exams, so it will be a habit for you to write in the same systematic answers. So in the main exam also, you will find it easy to write, and you will also save a lot of time in this. And most of the points have either answering is increased or decreased. So it will be easy for you to write. So make an answering format for each type of question and just follow it. So this is for this 10-mark case questions. So this is just the format which I have made. So you can also use this format. So first you can write the introduction part, then in preoperative assessment and preparation part. In the preparation part, you can see this Canada is a mnemonic which is same for all cases. So this Canada part you can write for all cases. You did not think about it. And apart from that, in the preparation part, you will be writing prehabilitation ERAS protocol and case specific preparation things. So that is depending on the case, but this Canada informed consent, anti-aspiration, NBM, it's for all cases. So you can write this mnemonic and it will be easy for you. And then intraoperative, you will have to mention what is your plan. And then in OT preparation, you can use this mnemonic, SOAP me. So this you can mention it. And apart from that, induction, maintenance, hemodynamics, and extubation. And post-op part, you can use this mnemonic America for the case questions. And then in complication, you can see there is also a mnemonic ABCDEF. And you need to think about it, but when you write, you make sure you write as surgical part, acute complications and chronic complications, and then anesthetic complications. So it will be easy for the examiner to analyze your answers. So, and then you can write recent advances and conclusion. So this is how you write a case question. When you write a case question, most of the time the marking system will be like in pre-op markings must be like 3 marks, intra-op 4 marks, and post-op again 3 marks. So make sure you write it in such a way. So in this paper, if you see the post-operative, only you can see this small part in the page is written for post-operative, though everything has been covered, but it doesn't look very good. So the same answers, when you write like this, so you can see the same thing has been written, but it is written in a nice way, so that the examiner also knows that you know these things, and then they grade you, they give you better marks. So this is how you will have to write. And then for drugs, you can use this format for all drugs that you read. So use this format so that it will be easy for you to also study the drugs and remember in a better way. And then nerve blocks, it is very important. So in my exam, I had got like 3 to 4 questions just from the nerve blocks. So these a very important part in your exam. So make sure you read all these things and you use this format to write the answers. And then these are some definitive questions as per old exam papers. So these questions, if you see the last 5 years, at least 1 or 2 questions definitely comes from these 12 to 14 questions that I have given here. So if you read this, most of the time you will be getting at least 2 to 3 questions from this pool of questions which I have got it from the old papers. So make sure you read all these questions. So when you write system wise answers, for example, when you're asked on anesthesia management for an obese patient, so instead of writing that patient will be having hypertension, more chances of MI, and cardiac out will be high, it's a very haphazard manner. So you make sure you have this format, and if you write in this way, it will be easy for you to cover all the points, and also when you give your practical exams you will remember in a better way. So cardiac, you see anatomical wise, what will you see? Chamber hypertrophy, valve stenosis, and conduction blocks. So these things, and physiologically heart rate, stroke volume, cardiac output, all these things what happen. So if you write in this manner, so you will cover all the points. Same thing I've given for other systems also. So when they ask for goals in cardiac system, you should always write preserve oxygen demand and supply. So apart from that, rate, what will you keep? Rhythm, so map, preload, afterload, and contractility. And then for respiratory system, same thing, I've given a format, you can use this. And respiratory system goals. And this is a special thing in one lung ventilation, COPD, and lung cases. You will be asked about preoperative preparation of the patient. So this is a very important thing. So I have made this mnemonic. So ABCDE, you can use this. So all these patients will have this hydration, antibiotics, bronchodilation, spirometry, cessation of smoking, chest physiotherapy, deep breathing exercise, dilate the airways, and education and expel the mucus with mucolytics. So these things needs to be mentioned in the preoperative evaluation of a patient who is going to undergo one lung ventilation or a COPD case. So same thing, formats for CNS and renal system and liver and obstetrics and pediatrics. So coming to practice exam, so this is very important. So before your exam, you should make sure that you give this practice test, and this will help you in time management, and it will also help you answer the questions in a specific format also. So during the exam, it will be easy for you to write the answers quickly, and you will be saving a lot of time just because you have practiced writing. So make sure you get the DNB style sheets, the one which I had shown in the previous slides, the horizontally long. So those kind of sheets will be given in the actual exam also. And when you write a practice exam, keep the timer in reverse. So because that is how you will be given in the examination. So the questions will be displayed in the computer, and the timer will be running in reverse from 180 minutes. So it will be difficult for you to comprehend what time is it, how much time is left, and which question. So those things will be difficult if you do not practice in such a manner. So when you go for FAT exam, you will come to know about it. And use dedicated formats to write answer. I have shown already. If possible, use same color pen. So only blue and black is allowed. So make sure you use these colors, and you can highlight it either with black, or if you're writing in black, then highlight it with blue color. So you can also practice previous year questions more. So because most of the questions that you will be getting in the actual exam can be repeats which have been asked in the past, but make sure at least you have seen the last 5 years question paper. And so last 1 month, I'm sure you will be relieved of your duties and you will be studying. So most of the students will be just studying in the last 1 month, so they will not have practice of writing. So when they suddenly go into the examination hall and they start writing the first question, it will be difficult for them to write. So this is why you should make sure the last 1 week before exam, you are giving practice exams, at least 3 questions in 1 hour, and keep the timer in reverse starting from 180 minutes. Okay, so it will be easy for you to replicate the same thing in the examination hall. And make sure you revise your notes at least 3 times before going to exam. And how will you write answers? So make sure you write neatly, and 5 pages are allotted per question, and you should write in bullets format to save time. So these So you can see this example. So instead of writing all these patients have increased incidence of blah blah blah, you can write increased GERD symptoms and treatment. So it should be like short but to the point. And make sure you draw diagrams, graphs and flow charts. So make sure you, when you write notes, you prepare a diagram for it or a graph or a flow chart, and you draw the same thing in the exam. So in the exam you should not be thinking what will I draw, how will I draw. So you should have already prepared a diagram for each question, and make sure you replicate it in the examination center as well. And do not waste time in one question. So whatever question you know, you can start writing it. So even if you don't know any question, do not leave unattended. So you should write at least something like introduction, just something about the question and the conclusion. So these kind of questions are mostly you'll be making up a story, so you can write it at the end. Do not waste time in these questions. So whatever question you know, you can start writing it first. And you should label the diagram and mark the parts always, because this carries marks. If your marks will be cut down if you're not labeling the diagrams or marking the parts properly. And in the exam day, this is the most important thing: get good sleep before night. And last 2 days focus more on paper 1 topics, physiology and statistics, and reach exam center early. Carry a paracetamol tablet with you. And when you get your answer sheets, you should check the page numbers, because sometimes certain page numbers are not present. So if you see it later on, then it becomes very difficult. So initially when you get the answer sheet, you make sure there are 50 pages and there is no missing pages in between or duplication of pages. And mark question numbers once you get the question paper. So when you get the question paper, in first page write number 1, in sixth page write number 2. So you can fill the paper in that way, so that you do not write answers in a wrong manner. So this is because when you have given 50 pages, and each pages each question you will have to complete in 5 pages. For example, first question you have completed in 2 pages, so you cannot start the second question from third page. You should start the second question from the 6th page as per the rules. So in case if you start the second question from third page, then that question will not be counted. So this is why I'm telling you should number the question. So page number 1 you write number 1, page number 6 you write number 2, so that by mistake you do not answer in the wrong page. And then when near the question, you can write the numbering things. So time remaining. So first question you'll have 180 minutes, so write 180. Second question, so you will be having at 162 minutes, that is 18 minutes per question. So there is 10 questions, 180 minutes, so each question 18 minutes. So when you start writing the first question, timer will be 180. As you go to the second question, in case if the timer is 150 showing for 55 minutes, it means that you are going slow, so you need to pick up the pace. So near the second question you can write in pencil as 162, so that when you start writing the second question, you will know that at 162 minutes you should have started the second question, but the timer is 155, showing 155. So later on you can erase all these numbers. So if you write these numbers, it will be helpful for you. And at least 10 minutes before the exam starts, you should have the exam papers with you, so that you will be because you will also have to fill your name and your roll number in the OMR sheets. Not the name, mostly it will be roll number. So these things you'll have to shade all those things, so it will also take some 2-3 minutes. So make sure you before 10 minutes you have the answer sheets with you, so that you can check, and if there is any mistakes you can change the sheets as well. So if it gets delayed, then the exam time starts, it doesn't wait for anyone. So you will have to have these things beforehand, and once you get the answer sheets, you can mark the page number and timings. And long questions, write down salient words in answer sheet. Okay. And once you start you're towards the end of the paper, your handwriting will start getting bad because you'll have less time and more things to write. So in that case, you can just start writing answers in a uh, big manner. Do not write it very small. Then with bad handwriting and small words, it becomes difficult to read. So when your handwriting starts getting bad, you can start making the words look bigger so that the examiner can know what you have written. So these are the things which I wanted to tell about the theory exam for DNB. So I have also made a separate PPT for practical exam also. So if you're interested, let me know. Soon I'll post the video on that also. Thank you.